Before you buy another expensive antiseptic mouthwash for bleeding gums, bad breath, or gum irritation, look in the spice section of your supermarket. A $1 jar of small brown flower buds contains a powerful natural compound used in dentistry for generations. That spice is clove. But here's the part most people get wrong. Clove is not a cure for gum disease. It cannot replace brushing, flossing, dental cleaning, or professional treatment. But used carefully, it may support the same goal as many oral care products: a cleaner mouth, calmer gums, and fresher breath. After 50, gum problems become more common. You may notice bleeding when brushing. Your gums may feel tender. Your breath may not stay fresh. Or your dentist may mention plaque, gingivitis, gum recession, or early periodontal disease. Then the shopping begins. Antiseptic mouthwash, gum care toothpaste, breath sprays, whitening rinses, special oral care kits. Each bottle promises a cleaner mouth. But the cost adds up quickly, and some products create new problems. Alcohol-based rinses may burn sensitive tissue. Strong antiseptic rinses may cause staining or taste changes. Some people use mouthwash so often that they believe it can replace careful brushing and cleaning between the teeth. It cannot. Gum disease usually begins with plaque, a sticky film of bacteria that collects near the gum line. A rinse may help reduce bacteria, but it cannot scrape away hardened tartar. That requires a dental professional. Welcome to Apex Ledger, where we examine affordable health habits with calm evidence, not miracle promises. Clove has a long history in oral care, but so does misusing it. Before I show you exactly how to use it safely, you need to know what it can't do. Cloves are dried flower buds from the clove tree. For centuries, people used cloves for tooth discomfort, mouth odor, and digestive complaints. The most famous compound in clove is called eugenol. Eugenol has a strong aroma and a warming, numbing quality. That is one reason clove oil has appeared in dentistry, especially in materials used for temporary fillings or dental dressings. To understand how clove may help, imagine the gum line as the edge of a garden path. If leaves and dirt collect there every day, the path becomes messy. Plaque works in a similar way. It collects along the teeth and gums. If it is not removed, the gums can become red, swollen, and more likely to bleed. Clove does not sweep plaque away like a toothbrush. It does not remove tartar like a dental cleaning. But clove compounds may help create a less friendly environment for some bacteria. Laboratory studies have found that clove and eugenol can show antimicrobial activity against certain oral microorganisms. Eugenol has also been studied for soothing and anti-inflammatory properties. This may explain why clove has a reputation for temporary tooth and gum comfort. But this is where we must be careful. A laboratory dish is not the same as a human mouth. In the mouth, bacteria live in complex communities called biofilms. Biofilm is like a stubborn layer of slime on a surface. A simple rinse may disturb it, but it does not fully remove it. Mechanical cleaning is still essential. That means brushing twice a day with fluoride toothpaste, cleaning between the teeth, and seeing a dentist when gums bleed or pockets develop. Clove may be helpful as a supporting habit, not as the main treatment. In a moment, I'll give you the exact amount and timing dental sources consider reasonable. But first, here's the single most common mistake people make with this spice. There is also a big difference between whole cloves and clove oil. Whole cloves are a food spice. Clove oil is concentrated. Concentrated clove oil can burn the gums, irritate the mouth lining, and cause ulcers if used incorrectly. Putting undiluted clove oil directly on the gums is not a safe daily routine. For older adults, this matters even more. Many people over 50 take blood thinners, diabetes medicine, heart medicines, or several prescriptions. A strong herbal oil may not be harmless simply because it is natural. The honest conclusion is this: clove has real traditional use and promising biological properties, but it should be used gently, in food-level amounts, and never as a replacement for dental care. Here is the safest way to try clove for oral freshness and gum support. Use whole cloves, not concentrated clove oil. Take 2 whole cloves, lightly crush them with the back of a spoon. Place them in a cup. Add about 8 ounces or 240 milliliters of hot water. Cover the cup and let it steep for 5 to 10 minutes. Then strain it carefully and allow it to cool until it is comfortably warm. Do not use it while it is hot. Do not swallow large amounts. Use it like a gentle mouth rinse. Take a small sip. Swish for about 15 to 20 seconds, then spit it out. Start with this routine 2 or 3 times per week, not several times per day. If your mouth feels comfortable, you may use it once daily for a short period, but it should not replace your normal oral hygiene. The order matters. First, brush your teeth gently with a soft toothbrush. Brush along the gum line without scrubbing aggressively. Second, clean between the teeth using floss, interdental brushes, or another method your dentist recommends. Third, if you tolerate it, use the mild clove rinse. Do not rinse immediately after fluoride toothpaste if your dentist has told you to leave fluoride on the teeth. In that case, use the clove rinse at a different time of day, such as after lunch. Watch your mouth carefully. If you feel burning, soreness, increased redness, ulcers, swelling, or numbness that does not quickly fade, stop using it. Do not chew cloves against sore gums for long periods. That may irritate the tissue. Do not use clove oil directly on your gums unless a dental professional specifically instructs you. And do not use clove to delay dental care. Bleeding gums are not normal aging. They often mean inflammation is present. The most effective, low-cost routine is still simple. Brush twice daily, clean between the teeth daily, drink water after meals, limit frequent sugary snacks, avoid smoking, and keep dental appointments when possible. Clove may help support freshness and comfort, but it cannot do the work of a toothbrush, floss, and professional cleaning. Always consult your dentist, doctor, or pharmacist before changing your routine, especially if you take blood thinners, diabetes medication, several prescriptions, or have mouth ulcers, oral cancer history, bleeding disorders, liver disease, or upcoming dental surgery. Seek dental care if your gums bleed regularly, your teeth feel loose, your gums are pulling away, you have pus, swelling, severe pain, fever, or bad breath that does not improve. Those are not problems to manage with a spice. The lesson is not that clove magically beats every expensive treatment. It is that a $1 spice contains compounds with a long history in oral care, and it may offer gentle support when used safely. Have you ever used cloves for tooth discomfort, gum irritation, or bad breath? Did it help, or did it irritate your mouth? Share your experience in the comments below. For more calm, affordable, science-based health guidance after 50, consider liking this video and subscribing to Apex Ledger. The healthiest mouth is not built by the strongest rinse. It is built by small daily habits used carefully and consistently.